Great. So good morning, everyone. Thanks so much for taking the time to join us for the June quarterly Long Island Health Collaborative meeting. So sorry, letting some more folks in. Okay, so it's a little bit of a different meeting today. Usually I'm joined by my colleagues, Janine Logan, Vice President of Communications and Population Health for the Nassau Suffolk Hospital Council, and Hannah Moore, who is the Director of Community Health Initiatives. But they are, unfortunately, they're up at Haney's. Our parent organization has an annual meeting currently, and that's where they are. So I will be your fearless leader today, just going through our agenda. If you do have any questions for Janine or for Hannah specifically, I will certainly relay those to them. And we're also joined by Melissa Bauer from DataGen, who is going to go over some of our CHAS data today. But before we get too far into that, we will start with introductions as we usually do. So I'm Brooke Oliveri. I manage the Long Island Health Collaborative. My primary role is the Associate Director of Communications, Marketing, and Public Health Initiatives for the Nassau Suffolk Hospital Council, which oversees the Long Island Health Collaborative. I'm just going to go around the room here and call on folks as I see them. Gary, do you want to introduce yourself first?
Sure. Good morning, everybody. My name is Gary Carpenter, and I'm the president of Gary Carpenter Associates, Inc. We are a New York State management consulting firm in the home health care industry, representing providers throughout the state. In Long Island, I spend a lot of my time helping individuals navigate the maze of home health care. In my spare time, I sit on the board of St. Catherine of Siena Hospital in Smithtown, and I'm the chairman of the Long Island Council for the Multiple Sclerosis Society. That's me.
Thank you for that, Gary. Kelly, would you like to go next?
Sure. Hi, everyone. My name is Kelly DeVito, and I am from Horizons Counseling and Education Center.
Thank you for being here. Emily Galvez.
Hi, good morning, everybody. My name is Emily Galvez. I am the bilingual community educator for the Epilepsy Foundation of Long Island.
Thank you. Great to meet you. Janet Romeo. We can always come back to Jen in a minute. Elena Jenkins.
Hi, good morning, everybody. My name is Ilana. I'm from Nassau County. Oh, it's okay. I'm from Nassau County Department of Health, and I work as an epidemiologist there.
Thank you for joining us. Alana, I will remember that. Janet, do you want to introduce yourself?
Hi, yes, I couldn't find my microphone button.
No worries. It's a lot of buttons.
Rough morning. Janet Romeo, Assistant Vice President of Epilepsy Services for the Epilepsy Foundation, Long Island.
Thank you. Carrie, would you like to go next?
Hi, everyone. Carrie Smith. I'm the President and CEO of Family Service League. New, 2 months into the role. So nice to meet everybody and be here.
Welcome, and thanks so much for joining us. Analia.
Good morning. I'm Analia Trask. I'm a program coordinator at Stony Brook Cancer Center's Community Outreach and Engagement Office.
Great to see you, as always.
You too.
Dr. Mermelstein.
Hi, I'm Linda Mermelstein, and I'm sorry my camera's not working for some reason. Oh, there we are. I'm the Associate Director for Community Outreach and Engagement at Stony Brook Cancer Center. I work with Emily. Thank you.
Thank you. Great to see you. Karen Cummings.
Good morning, everybody. My name is Karen Cummings. I'm the Director of Community and Government Affairs for Live On New York, and we facilitate all the life-saving transplants.
Parkway East towards Montauk for 6 miles.
Thank you, Karen. Dr. Rahman.
Hello, good morning. I'll join in camera momentarily. Good morning, everyone. Nice to meet you and glad to be here. I am the founder and CEO of Vibrant Women Wellness Counseling. We are a minority women-owned behavioral health practice, and we focus on assisting individuals experiencing trauma, anxiety, depression, stress, and grief. And our team is open and ready to assist. So thank you for having me here.
Great to meet you. Thank you so much for being here. I see a phone number ending in 8268. Would that person on the phone like to introduce themselves?
Yes, hi, thank you. This is Allison Puglia, and I am the Manager of Payment Assistance Outreach at PSCG Long Island, and we help people with payment plans, discounts, and other programs and services to help them make their bills affordable.
Thanks so much, Allison. And we just had one other person join. I do not want to put you on the spot. But Christy, if you are able to introduce yourself, please do so. Otherwise, no worries. And you just joined.
Hi, I'm Christy Golden from Stony Brook University Hospital. I'm one of the hospital administrators here. It's nice to see everyone.
Likewise, thanks so much. And Melissa, would you like to introduce yourself, please?
Sure. I'm Melissa Bauer. I work at DataGen, which is a subsidiary of Haney's, and I do the data analysis for the Shaw survey.
Thank you so much. And we're going to hear a little bit more from Melissa in just a little bit. All right. We did just have one other person join. And again, I'm sorry to put anyone on the spot. Christina, would you like to introduce yourself?
Hey there. Yes. Hi, guys. I'm Christina McMahon from Victory Recovery Partners, Regional Vice President of Nassau County, and we're an outpatient substance use disorder program.
Awesome. Thank you so much. Excuse me. All right. So just to kind of take a look at what we're going to cover today, it is a pretty brief agenda compared to others we've had. So I think we will be able to give you guys some time back today, but we're going to go through some collaborative updates, and then we're going to hear from Melissa to dive into really how to navigate the community health assessment survey data that we provide for you guys. But first, we will give a brief update about our case study. So as existing members of the group may know, we have been working on a case study for, I think it's been about a year now, where our goal is to produce an article for publication really reflecting on the work that the collaborative has done, reflecting on its origins and how it has evolved to stay relevant over the past, I want to say it's quite a few years. I think it started back in 2013. So there is a lot of history to kind of dive into there. We are nearing completion of our first draft. And excuse me, I'm just going to take a sip of my beverage here so I can stop clearing my throat. Thank you, Melissa. So we were going through some of the archives and looking at some older documents, specifically the initial survey and how that got going. And really what is popping up in some of those older documents is the common goal of improving health around our common priorities, which I think is not news to anyone who has been a longtime member of the collaborative. And that is certainly what kind of holds us together today, are those common priorities. So we are still working on that first draft. We do not have formal meetings scheduled at this time, but if you would like to reach out to us and get more involved in the case study, we would love to have your contributions. So, and certainly when we have that first draft, we'll be sharing it with the group. We do just want to briefly recap an event that we held. As you all may know, we work with the New York Coalition for Transportation Safety. We are a subcontractor on a grant they hold to deliver law-based pedestrian safety education on Long Island throughout Nassau and Suffolk counties. So we did hold our largest event of the grant period on June 11th. And we were really grateful to partner with Catholic Health, who was planning to host us in person at their Melville facility. Due to some unforeseen circumstances, we did have to pivot to a virtual format, but we were really pleased with how many folks were able to attend with that virtual format. And the recording is available online at this time. And we just wanted to take this as a reminder that we do this education. We provide, law-based pedestrian, bike, traffic safety, and now micromobility safety programming. So if that's something that you or your organization would be interested in learning more about, we would love to work with you on that. So you can always contact us directly. excuse me. And there was just a lot of great coverage of the potential solutions to some of the really kind of alarming safety issues we see on the roads with these micromobility devices, you know, folks riding underage, riding without helmets, and these injuries are all preventable. So thanks again to Catholic Health for their partnership on this. Okay, so this is a very wordy slide here, but we are also working with the United Hospital Fund and kind of supporting them in their efforts to recruit Medicaid members for an advisory committee that they are trying to assemble. So we are hoping that if you all work with, you know, Medicaid members and you think they would be interested in participating in these committees, we ask you to please contact us directly, really Janine. So there is an application that we have linked here in the slides, and we have some additional information linked here. But really, it's to give, you know, Medicaid members the voice that they really deserve in this ongoing conversation about, you know, the future of these insurance programs in our state and how they can really better serve and meet the needs of the folks who truly need to take advantage of it. So, as I said, we're supporting the United Hospital Fund and the Department of Health in this effort. So if you do know of any folks who would be interested, please do reach out to us directly. Any questions about that before I move on? All right, so moving on to some ongoing things that we always discuss at these meetings. The Community Health Assessment Survey is an ongoing survey that we deploy to gauge the health perceptions of Long Islanders. Melissa is going to speak to some of that in a little bit, but I just want to remind you all that this is ongoing. We are always collecting responses, and we really appreciate your efforts in collecting more responses. So all of our materials are available on the LIHC website. We have digital links to the survey in English and Spanish, and we also have hard copies of the survey that you are able to print, bring with you to your community events, and we enter them on our end into the digital model. So you send us your paper copies, and it all feeds up into our main SurveyMonkey collector that we analyze annually with Melissa's help. As a reminder for the hospitals and health departments that might be on the call, we did provide you with individual links, so you are able to get an individualized export of the raw data that you specifically collect in your community, in addition to the full analysis that is unchanged and delivered to everyone. I do just want to give a shout out to Catholic Health. They are really ahead when it comes to collecting responses with their individual links, and they're doing a great job. We are going to deliver a 6-month report to you all, just letting you know how many responses you've collected, and just reminding you that these materials are available for you with your individual link to continue pushing. To quote Janine, data out is only as good as data in. So the more responses we can collect, you know, the more robust, convenient sample we will have at the end of the day. So we thank you all for your ongoing efforts to collect responses. Any questions about the survey and the individual links before I move on? Okay. Just see chat. Oh, Odessa, I can connect with you. So at Suffolk County DOH, I'm trying to think of who our contact was there, but I will connect with you offline and make sure that you do have the link in those materials, if that's okay. Thanks so much, Odessa.
Yeah, if you wouldn't mind, could I get a link as well, please?
Yeah, absolutely. Yep, we had Stony Brook Medicine by facility, but we should absolutely, yeah, for the Cancer Center, we can certainly provide a unique link.
Great, thank you. Can we put it on our website?
Absolutely. Thank you, Dr. Mermelstein. Okay, and then just as a reminder, we do have our bi-weekly collaborative communications newsletter. That goes out every other Monday with free resources, events, job listings. If you have anything for inclusion, please do send it our way. It goes out to our contacts, many of whom are community-based organization representatives, leaders. So it's really a great space for sharing your resources with other folks who might be able to amplify it to their clients. We also have a free events calendar on the collaborative website where you are able to submit your events. So please do that. We approve them directly. So it's pretty simple to just upload your event and have it in another area online for folks to access. And then just another reminder, as part of our pedestrian safety work with the New York Coalition, we do Walk with a Doc and Walk Safe with a Doc events, which are really just community walks where we can, shine a light and spotlight the physician expertise of a doctor from a local hospital and go for a walk with them, deliver some health education to folks who attend. And when we are in a busy downtown, we also employ the New York Coalition to deliver some walking tips for walking safely. So if you are interested in an event like that for your organization or even for your clients, please do let us know. We also continue to revamp our Live Better campaign and promote the core cluster work products that you all worked so hard on over the last, well, it's been a while now, but we do continue to push these out. We have a static training module all about cultural competence and health literacy that is available on the website at all times. We also created this, it's really a workforce development guide that talks about all of the different and diverse career paths that exist in mental, behavioral, and cognitive health. And we also have a resource guide for young adults with chronic conditions that resides on the website. And there are some folks on this call today who really heavily contributed to these work products. So I just want to thank you all and assure you that we are still continuing to receive traffic on these websites, on these pages as well. So while, the work is done, it's really, the products are out there and I think folks are really benefiting from them. So thank you all for your efforts on that. One final reminder, and then I'm going to stop talking pretty shortly. Here at the Collaborative, we do offer very affordable communication services for nonprofits and community-based organizations. We really, here at the Collaborative, we really do not have much funding ourselves. So we've gotten very good at creating campaigns and really amplifying our messaging on a shoestring budget. And we would love to do that for you and your organization if that's an area in which you need assistance. And it's really Janine and I who do the campaign work from conception to execution. So if that's something that you would be interested in, we would love to kind of hear what it is that you need assistance with, or if you have any questions for us about this, we'd love to answer them. So I'm going to turn it over to Melissa in one moment here. I just want to remind you all that at the last meeting, we did kind of briefly discuss the results of the 2025 Community Health Assessment Survey. This is just kind of like a high-level overview of what those results entailed. So we had 467 surveys. This is the breakdown by county. And I just wanted to link the fact that we have the summary report and the Excel model that Melissa is going to show us on our website. And that's available for you to download at any time. And now Melissa is going to take it away and show us how we can really use it to take a look at what the data is showing us. Sure. So I'm going to stop sharing here.
Thank you so much, Brooke.
Thank you, Melissa.
Absolutely. So I'm going to share. And I'm sure that you have all seen this at this point. So I'm not going to go into super duper detail, but if you have any questions kind of while I'm talking, feel free to interrupt me, jump in and ask whatever it is you need. I'd be happy to have conversations as we walk through it. So I always think of this as the demographic page, this respondent information page, but that's really what it is. It's the information about the people that have responded to your survey. And this tab on the report is what I would call static. There are no filters or slicers to be able to change the information. It's just a snapshot view of everything about the respondents for all of the counties. So it would be Nassau, Queens, Suffolk, and then certain respondents, there were 19 that did not select a county to belong to. So as you toggle through it, you can see that the bulk of it is going to be Suffolk County. But we thought it was important to show all of the counties next to one another. And so we do have it in tabular form as well as graphical form. So as you kind of scroll down, you're going to see race and ethnicity, as well as certain questions that are in that respondent information section. So like, where does your family get most of their healthcare information, or the gender, age group of the respondents? And as you're looking through all of these become the slicers or the filters that are on the subsequent pages. So you can kind of say, all right, well, I know that I don't have any respondents in, in Queens for this age group, or I have very few for Suffolk in this age group. And it is going to be mostly, when we're looking at it, the 65 plus group, that is the bulk of most of these counties. But Suffolk County did a surprising thing this time around, and a lot of their respondents, 31.2, are in that 18 to 24 age group, which I found really interesting when I was looking at the results for this data. So it's just a thing to kind of take you to the next tab as you're looking at your information. Same thing for language spoken at home, household income, and then level of education, as well as health insurance information. So keeping those things in mind, we can go to the next tab, which is, I always refer to these as the meat questions, right? So which of the following health-related social needs are unmet in your community? And as we look at this, it looks like a ton of information, right? But say you're from Nassau County, you can simply click Nassau, and everything in this table is going to update automatically for you. The very first time, I did this on purpose, the very first time you click one of these, it takes a little bit longer for all of the information to compile. You'll see as it's reading data, it'll update, and you can tell it's working by this little loading data model here and reading data. And then all of a sudden your view will change. So you're looking at right now Nassau County for this particular question. And remember when I was saying before, these age groups, you can click these age groups and the data model will populate for that age group. So I can click 65 plus and drill into what the people that live in Nassau County that are 65 plus, how they responded. And if you don't so much care about the zip codes and you really just want the county as a whole, what you can do is you can right click on Nassau County, sorry, and hit this little minus, and it's going to show you your grand total. So your tally for all of those zip codes. If you decide you want to look at all of those zip codes again, you can click it. Another interesting thing that you can do is you can use this little filter drop down to clear all your values. So if you want to clear that slicer, you can hit that. Or if you want to look at Suffolk, you can hold your control key down and click that there. So you'll see Suffolk will turn blue up here. So bluish gray means that that's the data you're looking at, and that's how you tell if you're on a filter or slicer. The other way to tell is, see this little funnel with the X that's in red next to it? That means that something is filtered or selected. When you don't see that little filter light up with the little red X, it means you're not filtered on that. And that applies to all of these boxes here. So if you want to look at people that are in Nassau and or Suffolk County that are 65 plus and they are Black or African American, you can drill down into that level and be able to look at that population. If you don't like what you're looking at there, you can change it. You can unfilter it and send it back to where you were. So if I just minimize this, and it's going to show you your total number of responses That's this. So for Nassau, for this particular question in the 65 plus age group, you had 89 responses. And as we tab across, these are adjusted numbers. And what that means is there are a lot of applicable responses in the survey, right? So we adjust for how many are available and how many were chosen. So that's why you will see numbers that are kind of like a decimal as opposed to a whole number. And that means 6.67 times mental well-being and substance abuse were chosen in Suffolk County out of these 32 responses. So it's adjusted for that. It's weighted for that. And the same thing is going to apply to all of these tabs. We give you this information and you'll see how the things that I selected on the prior sheet, so this Nassau and Suffolk with this year age here, these are selected here. If I want to look at a different view for the next question, I can unfilter these and everything will come back. And that's going to apply to every sheet in this workbook. And we did that so that you don't have to select the demographic that you're looking for in every single sheet. It'll be pre-populated for you as you go along. And again, these function the same way. You can minimize them so that you can see the overall total, or you can open them up so you can see things by your town and zip code. And again, going to follow you through all the questions. So the ongoing health and social concerns for self, preventative, what prevents you and your family from getting medical treatment, which of the following is most needed to improve the health of your community, and finally, what health screenings or education information services are needed in your community. So these 6 tabs here are going to allow you to filter through that data and really drill into all the way down to that zip code town level. And then you have your Nassau rank and your Suffolk rank. And what we've done here is we've taken those 6 questions and then ranked the answers for the top 5 to give the value, the total value, meaning the total number of responses. And again, that's weighted, so that's why you'll see decimals. And then the percentage of times those were answered. And then they're ranked from 1 to 5. So you can see for each of these questions in Nassau and Suffolk County, what are the top priorities for the overall population. And so this is as if nothing was filtered. It's just everyone from Nassau County. What is their highest priority? And so that's going to be a rank of number 1 for each of these questions. So for what are the following health-related social needs that are unmet in your community? The majority, which is 15.18%, said mental well-being and substance abuse, excuse me. And then the same thing for the following questions. This top one is going to be what the highest responses were. And usually for Nassau and Suffolk, they rank pretty much the same, those top 5. Sometimes the 1s and 2 ranks will switch around for them, but roughly they're going to be the same 5 for each of those counties. But say you want to know, again, is mental well-being and substance abuse, which is top for both Nassau and Suffolk, is that going to hold true for my population that is 18 to 24? And when we click that 18 to 24 and we look at those health-related social needs being unmet, we can see that for Suffolk County, for 18 to 24-year-olds, that seems to ring true because their response out of the 79 people in that population looks to be a bit higher at 25.33 for that entire population. And even though it's a little bit lower of a number for Nassau County, there are only 12 responses. Mental well-being and substance abuse is still ranking at 6.5, which is higher than the remaining responses to that question. So you can effectively say that for that age group, yes, that is still the most important thing rank-wise. If we look at that 65 plus for those counties, we can look through and see that we had higher population, total number of responses for Nassau County, and it looks like mental well-being and substance abuse are not the highest priority for that age group. Safe and healthy communities in Nassau County is the highest rank for that group. In Suffolk County, there were 32 responses, and it does look like, yeah, that mental health and well-being and substance abuse are going to be the highest priority for that group. So that's kind of how you can leverage these tabs or these filters / slicers on the side here. And again, we can do the same thing for all of these boxes, right? So we can look at race populations, we can look at ethnicity, we can look at gender, that education, that employment, the health insurance. Do they have it? Do they not? So if we click, people don't have health insurance, right? So we'll touch that one and we can look at that population. So we're looking at the population and see how these are a little bit gray. That means that no one that does not have health insurance were in these age brackets. So that means the age brackets we're looking at are just these top 4 here. That's why they're a little bit darker of a shade. So you can kind of see, if people didn't have health insurance, it looks like their priorities are roughly the same, which is a pretty low population. So it's not a huge thing to go by. But that's how you can leverage this information. Does anyone have any questions for me? Okay.
Well, I'll just say thank you, Melissa. Just as a side note, of course, this survey, it was really born out of supporting the hospitals and health departments in their community health needs assessment efforts, which is required on the state and federal level for hospitals, and the state level for health departments. So, however, there is much more applicability, I think, for everyone in the group. If you, want to supplement some of your secondary data with some of this for perhaps your grant applications, or maybe there is a thematic report that you are writing, please feel free to use this data anywhere you would like to.
Is that a spreadsheet available on the LIHC website?
Yes, it is on our data resources page, which that is linked in the slides. And it is actually one of the main navigation pages on the site. So it is very accessible and it is on there for you to download at this time. So actually, let me see if I can share the page when I click this. Can you all see the web page, or is it just the slide still?
We can see the web page.
Great. So it's on its own little page here, data resources. When you click, we have the CHAS data right at the top. So this is the full Excel model that Melissa was just going through. And then this is a summary that just kind of displays what the top responses were, kind of like the last page of the model that Melissa was showing. Sorry. Say Walk Safe Long Island blog in progress. That's what I get for having a million windows open. But you can see that this is what the summary looks like in addition to the Excel.
And Odessa had a question about
Yes.
if we ask about food insecurity, and indeed we do. So question 3, which is going to be, what are the biggest ongoing health and or social concerns for yourself? We ask about nutrition insecurity in addition to nutrition eating habits. So you'll see that answers for that there. And I believe we ask it again somewhere else, but I will have to double check on that.
Yes, that topic is kind of like embedded in the updated responses that we added that more closely align with the new prevention agenda. So just to kind of pull up the survey for reference for folks who might not have seen it before, this is the hard copy of it. And you can see a lot of the options here pertain to quite a few different topics, and we always have nutrition eating habits and then nutrition insecurity.
Right.
And these choices were chosen kind of by consensus by the CHNA work group that met for I want to say almost a year leading up to the due date for the most recent community health needs assessment. Yeah.
So on the spreadsheet, are we able to look at the number of people for each of those different answers, or is it just the top ones?
Oh, it's in all of the, here, let me share my screen again
Yeah.
if I can, Brooke.
Please.
Sure. So here is, I'm looking at question 5 right now. So if I filter to Nassau County, and I think I am also in, yeah, so I'm going to take off the health insurance because I want to just look at Nassau County as a whole. And I'm going to look at the whole. So as we look at the data, we can see that there are 100, I'm going to show you that in a second, sorry. There are 168 responses. And so if I tab through access to healthier food, that 8.92, that is the weighted number of people out of that 168 that answered that checkbox that said, we need access to healthier food as most needed to improve the health of our community. And then you can tell how many people answered that question in that way. But if you see that screen that I accidentally popped up, watch what happens. If I double click access to healthier food, it's going to give me all of the responses for that question. So if I scroll and look, there's going to be 168 responses here, right? So this is the number of responses that we had from Nassau County, and it's going to give me a 1 every time for that question. So mental well-being, safe and healthy communities, you can kind of see. And this column here is all of the free text that we allow people to answer for that question, right? So you can get to the entire survey by just double clicking on the table here. So if you're in there and you double click accidentally, you're going to get new sheets. And that is what that data is. Does that answer your question?
Yes, thank you.
Sure.
And while we are certainly not quite as adept as Melissa at navigating this model, we'd be happy to meet with anyone who has questions after the fact, or who wants, a more personalized walkthrough anytime.
Absolutely.
One more question. Is there any special operating system that you have to use that? Because I remember when I was working at the health department, I could never open the spreadsheet.
Yes, you should be able to. So what it is it's a power pivot model and it's built right on top of Excel. So you should be able to open it and do anything that I was just showing you in it. If you do have an issue, please let Brooke know and you and I can set up a meeting and we can figure out what the heck's going on with your computer. Sometimes there's a little setting that you need to take care of, but I can be happy to jump on a Zoom meeting with you and walk you through how to unclick that setting.
Thank you.
Absolutely.
Thanks, Melissa.
Sure.
Any other questions for Melissa? All right. Well, if you do think of any, please do send them our way and we will make sure that we get an answer for you. We really that was the entire agenda for today. So we do just want to remind you that we have 2 other quarterly meetings in 2026, one in September and one in December. We hope to see you at those meetings. And in the meantime, I hope everyone has a really great summer. I can't believe it's already summer, but here we are. All right. Well, thank you everyone for taking the time to join us, and you get about a little under an hour back. So
thanks.
Thank you all. Have a great day.
Thank you.